The other thing is very difficult to do, but and I don't know that we talked about it that much this morning, but we need to be able to bargain decent, fair compensation for the work that people do. And I mean, we talked about, we called them different things, but in Ontario now, the term is a personal support worker, a PSW. And, you know, before they were healthcare aides previously, and that healthcare aide might have had a 2-week course or a 6-week course, depending on when and where they went to school. But now a personal support worker is in a community college for probably about a year before they get their certificate, and they come out quite well trained. And yet they may be working for barely over minimum wage because of the, you know, the retirement home industry is where they get their jobs, or in home care in particularly, where those are particularly low wage areas. And again, just barely a decent wage. It also looks at the turnover rate because, again, if people aren't compensated properly, they're going to have to go somewhere else where they can work for more money. They have to make a living. The other issue that we have to deal with a lot in bargaining as well is flexible scheduling. And somebody said something about the 12-hour shifts, that they weren't a fan of the 12-hour shifts, but I can tell you that if you went anywhere that our nurses have 12-hour shifts and tried to take them away, they'd kill you. And I think my personal idea on this is that when we worked an 8-hour day shift, I didn't go home and put my feet up at 3 o'clock. I worked till 7 o'clock. I cooked supper and looked after the children, or the child in my case, and then I did the dishes and cleaned the house. But when I got home at 7 o'clock, usually somebody else had to do that for me, right? So again, I think that a 12-hour day, whether it's at work at the hospital or at home, it really doesn't matter much. But again, just an issue about scheduling, making sure that people have flexible schedules, trying to give them full-time work, and that is very difficult. Particularly, employers don't want to provide benefits. I mean, that is a particular issue. Drug plans are the hardest thing to negotiate. Getting drug cards in some of our nursing homes, that's been a major, major issue, because these employers, they may have a drug plan, but it's where the employees pay for the advance, and a lot of these women simply can't afford to pay for their drugs in advance. So again, there's some of these issues that we can address at the bargaining table. We also take to the bargaining table at every round of negotiations, whether it's a healthcare workplace or any workplace, a woman's advocate program that we've established within our union as well, that is training that's paid for by the employer, but a confidential woman's advocate in the workplace, that they're trained to be able to provide assistance to any of the members or anybody in the workplace that may be suffering from violence, domestic violence. So again, these are some of the issues that we've managed to address in our union. It is a never-ending challenge, and again, it will continue to be, but I thank you for giving me the opportunity, and